Welcome back. Gonna lag just for a moment, let a few folks sign on. I'm Jim LaPierre. This is Sober Now, streaming today on choosehelp.com, streaming on sobernows.com's Facebook page. If you haven't been over there yet, please go over, give it a quick like, and you'll get notifications for all of our live streams and other cool things that we're doing. Today's topic is it ADD, anxiety, or addiction? As always, very much welcome your questions and comments on topic or otherwise. Want to be a resource to you, want to see if we can help some folks get pointed in the right direction today. First place to start out, especially for those who are in active substance use disorder or in early recovery, one of the things that I often explain is that I'm kind of old school where addiction recovery is concerned. I have been practicing what we call dual diagnosis work for about 20 years now, but I say that your pathway to recovery, whether that's harm reduction, medicated assisted treatment, abstinence, whatever it is, has to be the priority, and it has to be the foundation of everything else that we do. In most cases, trying to diagnose someone with a mental health condition, especially in the first few months of sobriety, is really next to impossible. In fact, it's generally a really bad idea. If a person lived with a condition before they developed a substance use disorder, that's certainly worth acknowledging and noting, and it might be an important part of their recovery. But I think the starting point for that is we have to separate what is a organic illness and what is not. So in mental health, there are a handful of conditions that people are simply born with, and attention deficit disorder is one of them. Schizophrenia, schizoaffective disorder, and bipolar disorder are among them, and they're coded in DNA. We know this, and no matter how good or unhealthy a person's upbringing was, at different ages, they're going to manifest, they're going to come to the surface. Anxiety disorders, by contrast, are not genetically coded. They run in families, which is interesting because they're not passed down through genes. They're passed on through what is most commonly learned behavior. One of the things that drives a therapist nuts is when a person self-diagnoses. And of course, the internet has brought us resources like WebMD, and folks will read about symptoms and say, well, that's me. I have all of those symptoms, and so I must have that disorder. Sometimes folks end up with a self-fulfilling prophecy of going to a med manager, being prescribed a substance that seems to help them a little bit, and that substance is most commonly prescribed for whatever condition it is, and so that too becomes a self-fulfilling prophecy, where if the medication for this disorder created some benefit for me, then I must have that disorder. And this is just oftentimes not the case. So what we have is kind of a convoluted mess that we have to pull apart a little bit at a time. And in my experience, the very best way to do that is we look at the substance use disorder first. We look at the pathway to recovery. We look at safety is one of the most commonly overlooked aspects. So if a person's living with abuse, if they're in a domestic violent or intimate partner violent situation, if their basic life needs are not being met, we need to start at the bottom of Maslow's hierarchy and work our way up from there. And this helps us have a greater understanding of what is it that's really going on with a person. And of course, we really need to look at medical conditions. Anything that's happening with a person's physiological or neurological health is going to muddy the waters further in terms of what is an accurate diagnosis. The starting point should always be with your primary care physician in terms of exploring what is the damage that my use of substances has done to my body and perhaps to my mind. It's relatively rare that a person has some brain damage. It does happen depending upon the substance and how it's used. But a high percentage of folks that I've met in early addiction recovery have the fear that maybe they've done some permanent damage, and that becomes a slippery slope. when I talk with folks who are still in active use, particularly if it's late stage alcoholism or late stage drug use, there's a justification there where I've probably already done a lot of damage, so I might as well keep going. And in most cases, that turns out not to be the case. The body is wonderfully resilient, as is the brain. So it's relatively rare that we've done long-term damage or permanent damage. But what we need to explore is getting those basic life needs met, having a pathway to recovery, and having safety and stability in our daily lives. Then and only then should we start looking at, okay, and where do we go from here? Ideally, where we go is we develop a support system. We have people in our lives that hold us accountable. We utilize a fellowship or a program that supports our recovery process and our goals. And then at some point, once we've had sustained sobriety or management of our substance use disorder recovery, then certainly we can start looking at mental illness, things to improve your mental health. And in my experience, those most commonly revolve around having survived traumatic experiences. And that's a vitally important part of recovery that a lot of us never get to explore or maybe only touch on. There's an old saying that if it walks like a duck and it quacks like a duck, it's probably a duck. Sometimes it's not a duck. And here's where I'm going with that. The symptoms of a lot of different conditions overlap, not just in mental health. So for example, the way that I usually describe it is if I cough, I sneeze, maybe I have a slight fever. Do I have a cold? Do I have a flu? Do I have pneumonia? Do I have an upper respiratory infection? There's a number of different conditions that I might have because those symptoms are a part of all of those conditions. So too, active addiction looks like mental illness. It looks a lot like mental illness. It looks like going to extremes. It looks like manipulation and being deceitful. It looks like impulsivity and a lot of things that are unhealthy. So active drug use, active alcoholism looks a great deal like mental illness, but it's not. Early recovery looks a lot like mental illness, but it's not. If you're in the first year sober and you find yourself frequently feeling anxious or depressed, well, that makes sense, right? You're changing everything in your life. You've probably experienced a lot of loss. There's ongoing adjustments. There's regrets and shame and guilt and a whole lot of things in your life that are weighing you down. So when we're experiencing feelings of anxiety or feelings of depression, we have to consider our life circumstances and weigh those long before we go looking for the idea that maybe this is a condition or maybe this is a form of mental illness that I was born with. I think we're attracted to the idea that we were simply born with these conditions because that requires very little of us other than taking the right medication. Almost everyone that I've worked with in recovery has some amount of anxiety around the changes that are happening in their life. They have some, at least episodic depression because they reached a point of desperation, because they've lost loved ones to the disease, because they've experienced loss in their partnership or with their children or with their careers. They've lost material things. So again, we have to separate what is a product of my life experience and what is something that maybe needs to be explored with a therapist or even with a med manager. Depression is especially tricky this way because depression works both ways. We know that for some folks, especially if they live with major depressive disorder, sometimes that is genetically coded, and their brain, just the way that it works with neurochemicals like serotonin and dopamine, just isn't working quite right. And so no matter how good that person's life is, they're going to continue to feel depressed. But the advice that I give to folks, it's called Occam's razor. In layperson terms, it means the simplest explanation is likely to be the most accurate. So if your life sucks and you're depressed, hey, let's work on changing your life. And if medication is helpful with that, I'm actually pretty neutral about taking meds. If they help you, great. If they don't help you, that's fine. But let's not blame it on a condition. Let's look at the possibility that this is a product of our life experience. Okay, so it's a little hard to follow. I'm throwing a ton of stuff at you, but my hope is that we can make some connections going forward. And again, really want to encourage you to write in with your questions, your comments, your experience, because all of that makes this a little more interactive and hopefully more helpful. Okay, next step in the process. Anxiety disorders are a category of different conditions. So when we look at anxiety, the most common form is called Generalized anxiety disorder. And for a person who experiences this, there's frequent nervousness and worry. There's a real challenge in being able to relax. There's a lot of things that are going on there, but it's actually extremely common. Millions, tens of millions of people in the United States live with anxiety in this form. And it's worth noting that anxiety was at an all-time high in our country before COVID. Since COVID, the rates have escalated dramatically. Anxiety disorders also include all forms of phobias. They include things like Obsessive-Compulsive Disorder, which is another condition that I frequently hear folks self-diagnose with, and it's almost never accurate. Obsessive-Compulsive Disorder is actually fairly rare, and it involves two things. The first is an obsession, which is the thought that you truly do not want to have in your head, followed by a compulsion, which is an action that you truly do not wish to partake in. And those two things have to occur simultaneously. Now, again, the similarity here between substance use disorder and a condition like OCD is pretty strong. If you live with a substance use disorder, then you have the disease of addiction in your mind, tempting you to use, creating a compulsion. You find yourself obsessing over, am I going to relapse? Am I going to stay clean today? And it also mimics everything that we experience in active addiction, where progressively all we could think about in all of our choices and actions were centered around getting the substance, using the substance, recovering from the use of the substance, and getting more of it. Anxiety disorders also include things like agoraphobia, the fear of going out in public, and particularly through the course of the pandemic, we've seen a huge rise in this. Sadly, post-traumatic stress disorder is an anxiety disorder that is incredibly common for people in active addiction and people in recovery from substance use disorder. For way too many of us, this is what got us started on the road to addiction. And if we hadn't experienced trauma prior to the onset of a substance use disorder, there's an excellent chance that the places that active addiction took us involved traumatic experiences. Okay, so that's anxiety disorders. Let's talk about ADD for a minute. Years ago, we used to call it ADHD, and every once in a while, we revise the DSM and ideas we have about mental illness, and so we no longer call it ADHD. We say that attention deficit disorder comes in three types. The first one is a person who's primarily inattentive. The second type is a person who's primarily hyperactive. And the third type is a person who has both. I joke about this sometimes because when I was younger, I was very hyperactive, and now I'm just too tired and too old to be hyperactive. But attention deficit disorder is something I've lived with my whole life. It's a brain that goes 100 miles an hour, and what I've learned about that is that I have to keep myself occupied with projects and things that I really do enjoy doing, because when I focus on goals, when I focus on things that are really important to me, my mind doesn't wander to places that are unhealthy for me. It doesn't wander into depression. For folks who really do live with attention deficit disorder, depression is very common. It's hard to connect with people who necessarily have a mind and a perspective like yours. And so, sadly, those two things often go hand in hand. This brings me back to the overlap of symptoms. So, attention deficit, every single symptom of attention deficit disorder is also a symptom of post-traumatic stress disorder. So if we're not asking the right questions, we come to the wrong diagnosis, which means that too often we put people on medication that they don't need or that is even harmful to them. Almost all of the medications for attention deficit disorder are stimulants, and that too is a place that a lot of us got our start into active substance use disorder. If you place a child who really is not attention deficit on Ritalin, Adderall, Concerta, Vyvanse, all of those meds are stimulants, and what happens is it speeds them up even more. Excuse me, a person who really does live with attention deficit disorder, those stimulants have what's called the paradoxical effect. It slows them down. It seems very strange to think about it, but a person whose mind and body is going too fast, we give them a stimulant and it slows them down. This is the acid test that I provide to parents when they tell me they're worried that their child might be ADD. I'll say, well, let's give the kiddo a couple of Mountain Dews and watch how they act. If they get really hyper and bouncing off the walls, that's not attention deficit disorder. If they get really mellow and calm or even sleepy, then we should get them to a doctor because we've got some things to work on. It's obvious, but I actually didn't make the connection until I started working with folks who live with substance use disorders. It's not just stimulant medication that has that effect, it's all stimulants. So a person who uses cocaine, crack cocaine, methamphetamines, it's going to have, if they're ADD, it's going to have the same effect that medication would in terms of it'll slow you down. For some of us, it just seems to make it easier to think or easier to relax. But of course, ultimately, the use of those illicit substances is incredibly destructive, and it will obviously ruin a life in a very short period of time. Okay, so we have the overlap of ADD and PTSD, and then we can further connect that as all of the symptoms of substance use disorder are extremely overlapping with those mental health conditions. And so again, how do we separate which is which? The only surefire way to do that is by first promoting recovery from substance use disorder, promoting safety, and promoting basic life fulfillment. Then somewhere down the road, ideally a year from the day you get into recovery, then we can get a pretty accurate sense of what your baseline is, because your life will have changed dramatically over the course of that year. And there's a lot of things that we should be concerned about. There are a number of mental health conditions that are notoriously overdiagnosed in general, and specifically are hugely overdiagnosed amongst people who live in recovery from substance use disorder. At the top of that list, bipolar disorder, both bipolar 1 and bipolar 2. Attention deficit disorder is overdiagnosed, and borderline personality disorder. All three of those conditions are grossly overdiagnosed in my experience amongst people who live in recovery. The go-to medication for bipolar disorder is what's called a mood stabilizer, and it involves treatment with medications like Lamictal. Now, if a person lives with bipolar disorder, that means that they have episodes in which they have different levels of depression, and they have episodes in which they're manic. If you look real close at mania, what looks like mania? Well, it's a person who has endless amounts of energy. It actually looks a lot like a person who's done cocaine. So a person who does coke, in my experience, there's two main ways in which they present. They're either paranoid and don't want anybody around them, or they're annoyingly optimistic, they're going to take on the world and start a new company by Tuesday. Mania looks a lot like that. So if a person is abusing stimulant medication or street drugs, and they go to see a med manager or a psychiatrist, a psychiatric nurse practitioner, there's a really good chance they're going to get misdiagnosed. The secondary problem is I mentioned medications like Lamictal. So if a person has some level of depression, mood stabilizers are supposed to treat depression and mania. But if a person takes a mood stabilizer and they feel less depressed, that's the self-fulfilling prophecy of, I must have bipolar disorder because I feel better taking this medication that treats depression and mania. For most of us, particularly in addiction recovery, if we have either depression or anxiety, we tend to have both. And so the presence of depression and anxiety looks an awful lot like bipolar disorder. Depression and anxiety, depression and mania. The real test for mania is, can you go days at a time, at least 36, 48 hours with no sleep and feel like no impairment, you're not tired. If that kind of thing happens for you on a regular basis, we should probably look at whether or not that's a possibility for you. But if the reason that you're losing sleep or not being able to relax is because you're feeling really anxious, because you find yourself being really super hypervigilant, or your brain is just working through everything that's coming up in your life and everything you're worried about, that's not bipolar disorder. It may be some specific form of anxiety, or it may just be that you're in early recovery. Life kind of feels like a mess right now, and you have a lot of uncertainty about how things are going to be going forward. So again, let's take things slow. Let's separate recovery from substance use disorder from recovery from mental illness, and let's consider that surviving trauma throws kind of a wrench in all of those things diagnostically. Always feel free to seek out a second opinion. If your doctor or your therapist has given you a diagnosis that you're not sure is accurate, feel free to find a second professional and see what they think. Use Wikipedia. In my experience, while I don't encourage folks to go online and try to diagnose themselves, I do encourage them to go online and educate themselves about any condition that they've been diagnosed with. And in my experience, Wikipedia is actually a pretty good, solid, factual, if people who live with these disorders tend to have these types of symptoms, benefit from this type of treatment, and help you gain a better understanding of what it is you've been diagnosed with. The whole challenge here, I usually explain this by saying, the medical model is what we use for when the body is injured. So what's great about that is if you break your leg, you can go see 10 different doctors. They're all going to come to exactly the same diagnosis. They're all going to provide the same type of treatment and the same type of prognosis. But when it comes to mental health and even a lot of aspects of substance use disorder, it's very subjective. It's not something that we can simply observe and say, aha, that must be what it is. And so potentially you go to 10 different therapists and you get 10 different diagnoses and 10 different types of treatment recommended to you, and even 10 different prognoses. This is, in my experience, there's a lot of common sense that doesn't get used in science or scientific, quote-unquote, scientific approaches. There's a lot of aspects of recovery and treatment that are spiritual and artistic in nature. They're not hard science. They're not based on hard, specific facts. And so sometimes folks do get some really bad advice about what it is that they live with and what it is that they need to do about that. So I just encourage you to get that second opinion. I encourage you to get a ton of support and be open to outside feedback. For folks in recovery from substance use disorder, 12-step fellowships, what maybe your religious community, maybe programs like Celebrate Recovery or Smart Recovery, whatever works for you is awesome. But what's really vital is connecting with people who have a strong understanding of what addiction is. These are the folks that are going to be able to call you out when they see you heading down the wrong path. Having a lot of accountability in your life, setting your goals, but having people that hold your feet to the fire and check in with you, because left to our own devices, we're going to struggle to face fear. We're not necessarily going to follow through, and we oftentimes see it as acceptable to disappoint ourselves. We usually are pretty solid about the commitments we make to other people, but the promises that we make to ourselves are easily broken. And so what I've learned is the more that I expose my fear and my goals, It's beautiful that I get reassurance and support for those, but it's vital that I get accountability for those, because it ensures that I'm going to follow through and do everything that I need to do. So, I'm going to be wrapping up soon, but if folks have any last minute questions, I'm happy to entertain those. As always, I want to encourage you to connect with me. YouTube is a great place to do that. Sober Now's channel has about 125 or so videos on different aspects of recovery. They're completely free. If you subscribe to the channel, you'll get notifications of every new video blog and every new live stream that comes up. Would love to have you email me. Jim@sobernow.com is the quick way to do that. Let me know what questions you have. If you're struggling with any aspect of your recovery, I'd love to be a resource for you. And if there are topics that you'd like to see covered in future live streams, please share those. Always welcome those suggestions. And of course, I would love to have you check out our site, sobernow.com. Home study programs, opportunities to connect with complete confidentiality and anonymity, opportunities to explore recovery from substance use disorder, enhancing your recovery, and programs for affected others. Those of us who have loved ones in active addiction and have to cope with the powerlessness and the fear of losing our loved ones. So check all of those resources out. Drop me a line. Let me know how you're doing. And please take excellent care of yourselves and each other. This, as we continue through the pandemic, as we continue through life challenges, we need each other more than ever. And my hope is that I can be a resource to you, but my hope is that you'll take excellent care of you as you're going through just daily life. All right, I will look forward to being back with you next Thursday at noon Eastern Time. And again,